A broken arm is a common injury. Usually when we think of breaking a bone, we think of being rushed to the hospital to have our arm put into a cast. But tell me, Cassandra, what is the first thing that we should do if we suspect a broken arm?
Well, probably the first thing that someone should do if they expect that they've broken their arm or maybe their child's broken their arm is just make sure they're sitting with it supported. So whether that's using a pillow or a towel rolled up or a magazine, something to keep it from moving, because it's the movement that generally causes someone some pain. And then it really depends on if it's looking extremely deformed or causing a huge amount of pain, or you can actually see a bit of bone poking out, then those ones are straight ambulance call or straight to the hospital. But more often than not, it sort of just feels a little bit niggly and you're not really sure if it is broken or not broken. And really for those ones, from a first aid point of view, as I said, it's the support, it's maybe getting a bit of pain relief, so whether that's paracetamol or something like that. Keeping it elevated and icing it and just sort of seeing how it feels, a little bit later is sort of the first step.
And then what's next?
So what's next if it's still a little bit sore? I mean, I guess that's as hand therapists where we come in and where we often see people. So they're sort of not sure what they've done. They don't know if they've sprained it, they don't know if they've broken it, or they don't know if they're just sort of making it up or if their child's just being a bit fussy. So we get people in and we actually can do an assessment, so a hands-on assessment. We're looking at things like whether or not we think it's fractured or whether or not we think it's potentially just a sprained ligament or a torn ligament, which in itself can be not a very good injury either.
Sometimes it's worse than a break.
Yeah, exactly. Sometimes it's worse than the break. So organising x-rays so that we can look at the bone, we can make sure that it's aligned nicely, and if it's not, we can help the patient or the parent figure out what the next step would be.
Because sometimes we just go straight to the doctor or straight to the hospital, but you're saying people can come straight to you if they like as well? Yeah,
that's right. As I said, for certain cases where there's bones poking out or there's deformity or a lot of pain, then definitely the hospital has its place. But often it's really, if it's an injury that's managed conservatively, and what I mean by that is one that's going to go into a splint or a cast, then certainly we can be the people that they come to first.
Yeah, perfect. What if you have gone to the hospital first and they've, put a cast on, but you're a bit worried that, because obviously sometimes you do worry that it could be not putting in the proper place.
Yeah, and I think that's what we see a lot of, because I think what happens is that people get sent to the emergency department. It's busy, there's lots of things going on. They'll take an x-ray. Sometimes they can see a fracture straight away, but sometimes you can't. Some certain bones in the wrist actually take up to 2 weeks to show a fracture. So what happens is often people are sent away with generally quite bulky casts, and then they're told, we'll send you an appointment with the fracture clinic. Now that might be 2-3 weeks down the track, which can be a bit disconcerting because you're sort of stuck in this big heavy thing that might not be fitting well. And that's often where we say, just come to us. We can have a look at it. We can have a look at what cast you put in. We can re-x-ray if need to, or sometimes we can get those images direct from the hospital, and we can give you the answers there and then of what needs to happen.
Because I guess it's like, they're generalists, I guess, and they're used to seeing a lot of different fractures and things like that, but that's all you specialise in.
That's all we do.
Yeah.
So we can have a look at an x-ray and we can see for a child, for example, will it be in a growth plate, which is an important thing. For any sort of age, is the bone displaced? And what I mean by that is the bone no longer straight. So we can't expect a bone that's sort of dislodged to heal nice in a straight position. So we're able to look at those bones from an x-ray point of view and know what treatment is the best for that age and that person.
So why should people go and see Helping Hands even after they've had medical advice?
I think where we really help people is we're able to give people a lot of education. So what can they move versus what can't they move? So often people are really afraid of what they're allowed to do and what they're not allowed to do for their hand. And so they might not move their fingers for weeks, and suddenly the fingers become stiff and are a problem. So when they see us, we're like, yeah, let's get those fingers moving. Let's get your elbow moving. Let's get your shoulder moving so that we don't have any secondary problems. And then when it's time, we're actually allowed to move the wrist, which is probably earlier, and I'm talking about a wrist fracture, is probably earlier than potentially a lot of doctors think you're allowed to. So we tend to immobilize someone for the period that we know is needed for the bone, but movement is actually really good to make a bone strong. So we do like to move it as soon as possible. So from us, you're going to get exercises, and you're going to get exercise for movement, but you'll also get exercises to build up strength and build up condition. So that at the end of this sort of 8-week period, people are back to normal. They're not just, starting to try and move it again.
Yeah, because that's what often happens is you have that cast, you hardly move it, and then next thing you're having shoulder issues, and then you're having to relearn to use your hand.
That's right.
You've got months of recovery.
That's
afterwards.
right. And what we see in the clinic, we see people years later from a fracture, and they say things like, "Oh, I never really got my strength back in that hand," or I had a break when I was 14 and it never really was the same. And it shouldn't be. People should be able to get their full strength and their movement back within that 3 months of having an injury, not years later.
So interesting. So why do we need to worry then what happens with a broken limb if it's not treated correctly?
Yeah, well, if it's not picked up and it's not immobilized, so it's not kept still in the time frame that it's meant to, then the bone's not going to, either it's not going to heal at all, or it's not going to heal well, because a bone that's moving while trying to heal just builds up a lot of sort of calcification around it, and then so you actually get sort of a deformity within that bone. And if you don't pick it up, that can also lead to early onset arthritis, for example, because it might be at a joint that then the bone's not sitting well, so it's then rubbing against another bone. So that's sort of where it is an issue if it's not treated. And then what we see as well is over-treatment. And what I mean by that is you might have a cast that sort of covers parts of your fingers that shouldn't be covered, or might go so far up the arm that you can't get rotation. So if people are in a cast that's too big and immobilizing too many bones, then everything else stiffens right
Suffers,
up. Yeah. So we always try to look, and we always try to minimize what someone has. So we want to stop the movement at the area around the fracture, but we want to leave everything else free, because we want that person using their hand, we want that person moving, we want that person to be able to pretty well go on with their normal life, but just protect the area that needs protection.
It's so important. So getting your broken bone looked at by a specialist is the best way to ensure your broken arm heals correctly. The friendly team at Helping Hands is only a phone call away, so if you have any pain, an injury, or a concern about your fingers, wrists, hands, elbows, arms, or shoulders, Helping Hands are here to help. Don't hesitate to get in contact with Cassandra and her friendly team today. They're the upper limb experts, and they'd love to assist you.